They'll be here to pick me up at 10:30 to take me to my surgery. Y'all, I'm really about to get my titties done. Joe's taking me to the airport. Y'all, it's about to go down. Ooh. Yes, they have security inside of the facility. Hey y'all, so I just now left out of CG's Cosmetic, and I just did my pre-op appointment, and it went really good. I was in there for like 4 hours. No cap, you're gonna be in there all day. But this is the building behind me. Everything went good. The COVID test was done by finger. I gotta finish taking this nail off, and I gotta take this nail off. They're gonna need it for, you know, blood pressure, machines, all that stuff. So they told me those 2 fingers. Other than that, I gotta wait on the phone call to let me know about the time of my procedure tomorrow. So stay tuned. Okay, you guys. So this is the hotel. Staying in. It's really nice. It has like a little lounge. Well, it has like a little lounge area. Come in, it's super nice. Everything nice. Plated. Period. They got all the snacky snacks. Ooh. Be right back. So I'm just laying here. I've been waiting, and they called me and they told me that my surgery time is going to be in the morning at 11:30. So they told me to make sure I'm there by 11 o'clock. So I've already called my transportation services. I went ahead at 8. I ate at 9 o'clock. So I'm good to go. So in the morning, the surgery time, I'm just gonna pray for a great, successful surgery. Keep you all updated tomorrow. Good night, gang. Good morning. It is 8:45 in the morning, and I'm laying here. I'm really thirsty. My throat is so dry. I cannot have nothing to drink until after surgery, not even a sip of water. They'll be here to pick me up at 10:30 to take me to my surgery. I have to be there before 11, even though my surgery time is at 11:30. So I'm guessing they'll get them enough time to do my drug test, because they didn't do it at pre-op, but they're going to do it today before my surgery. They just did the COVID test yesterday at pre-op. So, oh yeah, I had to bite this nail off. Both of your pointing fingers can't have a nail on it. As far as nose rings, we discussed it yesterday. I can't get this one out. They use like some kind of pliers to clamp it down in my nose, so I can't get it out. So she told me don't worry about it. What they're going to do is just tape them down, that I should be fine. I've already prayed about it. My family's prayed. My friends have prayed for me. It's going to be a great, successful procedure. Everything's going to be good. Come in here, and then you come in, you check in. All I need today is just the bra. So, checking in. My doctors are coming here, so I'm excited, but I'm nervous. So keep y'all updated. Hey y'all, so I'm out of surgery. I got out of surgery probably like, I want to say 1 something. I got back to my room at like 2 something. And I'm so sore. I do remember being in recovery. Them putting my stuff on, the driver bringing me to my nurse, the hotel bringing out my wheelchair. It's just like my arms and my breasts and chest just so sore. Like, my nurse is going to fill my prescription and give me something to eat. Like, I'm so sore. Like, she gave me some medicine. And until she come back with my medicine, I guess I like just give y'all a sneak peek of what's like what I'm looking like a little bit, but you ain't gonna be able to see a lot because I'm so wrapped up and stuff. I'm still out of it with the anesthesia, but I have to give y'all an update, so I'll show y'all a little bit with this shirt. I'm so sore. Ouch. They're sitting up. And they got like gauze and tape and stuff everywhere, so you really can't see anything. But I'm all done, so I'm probably about to get some sleep. And then I'll talk to y'all in a bit. This is Nurse Elaine. This is who I chose to take care of me during my surgery. She is a really nice lady. We was in touch before I even came to Miami, as well as even after I left Miami from my surgery. She was in touch to check on me to make sure everything was going well. I highly recommend her. Go ahead and let her know that Tamisha sent you. This is her Instagram, so you guys please contact her if you're going to Miami to have any kind of surgery. She's wonderful. Right here is Nurse Elaine, and what she was doing is basically labeling my medications. She was writing down what time I need to take my medicine every day, so that way I can stay on topic with my medicine. Because when you're on anesthesia, you're not, in the right state of mind to keep up with this kind of stuff. And she'll also put alarms in your phone for you if you need her to, so that way she can make sure that you take your medication even after she leaves. I bet you're like, oh my gosh, it's a lot of medications on the bed. What is all that for? Well, they give you something for pain, something for nausea, as well as something for infection to prevent it. And of course, I had Tylenol extra strength so I can rotate. She did amazing. I highly recommend her, you guys. I'm not going to cap to you, gang. I'm not going to act like it was a walk in the park. This entire process is not a walk in the park. Like, you have to realize how much you need your chest muscles. You need your chest muscles to sit up in the bed. You need your chest muscles to talk, cough, sneeze, bend down to use the bathroom, drink, eat, whatever you need. Your chest muscles is very, very crucial. Those first 5 days are so intense and hurt extremely bad. I'm not going to say that you're going to be totally 1000% better on the 6th day. I'm on day 6 now, and I'm moving around really well and stuff, but I'm still extremely sore. But I'm not as bad sore that I was those first beginner days. So you're going to bleed, of course, like your first I'm going to say 1 to 3 days of surgery. So yeah, it's very painful. So don't let nobody tell you that it's not, because it is, and it's a process. I don't even want to put my face in the camera. They've been hurting so bad. Like, I'm so ready to get home. I can't get comfortable in the bed. I cannot get comfortable. Of course, I had breast augmentation, breast lift, but he also did a nipple reduction to make my nipples smaller. My breast, just my chest, everything hurts so bad. I'm ready to get home.
Right here, of course, I'm just laying in the bed. And yes, you have to sleep on your back. You cannot sleep on your side. So the whole process is totally uncomfortable. I just have to wait it out. So I go see them again on Tuesday. I have to fly back to Miami. And they're going to talk to me more about that. So I guess I'll update you all then. But with my breast size, what I did is I told them I do not want my breasts super big. I do not want no big old titties to the point where they look super huge on my shirt and the top of my body look big. You know, y'all know that look. I told them to make them a good size. I still do not know my bra size yet. My boobs are still kind of wrapped up with tape and stuff like that, like you see there. So I get all that stuff off on Tuesday. So I'll keep you all updated. This is the hotel that I stayed at during my stay. It was amazing. It's really, really nice. So if you're there as well, this facility is like maybe like 11 minutes away from the center. So I highly recommend it as well. On your post-op appointment date, you will receive this card right here, and on this card it'll let you know what size implant they put in your boobs. So for me, for my left side, they put 415cc in, and on my right side they put 450cc in. And for those of you that's, you know, not up to par on breast size or whatnot, one of your boobs is always bigger than the other, so that's why I have two different implant sizes. So check your girl out. Yeah.
Okay, you guys, so I'm at the airport and I'm headed to my 7-day post exam. So I'll keep you all updated when I get there. What's up, gang? So I'm gonna give y'all an update. So Tuesday on the 26th, I flew to Miami and I went to my 7-day post-op appointment. There they clipped the knots on the end of my sutures, just like a portion stitches, and they also removed the tape off my boob. Okay, so I'm here. I'm in the room right now. No, as y'all see, and I'm sitting here waiting. I'm gonna take the tape off, so stay tuned. I was not able to get as much footage as I wanted to while I was there. I just basically got some footage in the lobby, and I'll post it now. So here I was at my 7-day post-op. You see ladies are sitting everywhere. What I did not like about this day is, of course, I scheduled my flights based off my appointment times. So when I got there, they still didn't get me back there until an hour later. So it had me running late to get back to the airport. Okay, so then I got back home that evening on my flights, and my left breast started bleeding underneath. So I was like, oh my gosh, like I wonder, did they, do something wrong? Did I do something wrong? So I got to speak to Dr. Freiman. He's a very good doctor because he was able to speak to me on the phone immediately. And he was telling me to, of course, apply pressure if I felt like it was too much bleeding for me to go to. But basically, my camera went out, so he was telling me if the bleeding was too much for me to go to the ER, but he highly advised for me to just, of course, lay down and apply pressure to it, and if the bleeding came through the gauze, for me to apply a towel to it, that if it didn't stop by in the morning, to make sure that I go to the ER. He also told me that I could come back there so that way they can be able to take a look at it or whatnot, but preferably I can go to somewhere in my local area. So what I did is I contacted a plastic surgeon office, and they told me to go to a local hospital that they link with. So basically what the emergency room would do is call in the plastic surgeon to take a look at it. So I went to the emergency room the next morning because I was able to apply pressure on it enough that night to get it to stop. So I'm at an emergency room now. I contacted a plastic surgeon facility that's linked to the hospital. So the hospital is about to contact them to come here. So I'll keep you all posted. So yeah, this whole thing is a process. Don't think it's a walk in the park. So I did that and I got it to stop bleeding. Okay, so basically while I was at the emergency room, Dr. Freiman was definitely in touch with me still. He was emailing me and he told me that it was clot blood coming out, that if I see any more of the blood coming out, for me to squeeze it out. And I was not into doing that, so I was at the emergency room and I was letting the doctor and the plastic surgeon there know what he was saying, and they got the bleeding to stop. So they told me this, if I see any blood coming out, just go ahead and press on it slightly to be able to get the remainder of it out. But other than that, I'm healing up really well. I think that Dr. Freiman did a good job and his communication is awesome. He's very responsive if you need him. So I do say kudos to him for that. What do I think about CG Cosmetics staff? I think the staff is really nice. Everybody was very professional. I got in, I got out. Of course, it's going to be packed like it's a surgery center, but they're very responsive for the most part. I can say that. As you all see, I'm still healing. This is like the surgery bra. I don't want to give you all too much of a peek yet, but these are the surgery bras that CG Cosmetics sell. So it comes with 2 in a pack, so you can just purchase that, of course, when you get there, so they can let you know what size to get. But other than that, it was a good experience, I can say, for the most part. What I didn't like. One thing I did not like is you get a breast card for your implants because you get a lifetime warranty on your implants. But one thing I did not like is the misspelling of my name on my card. So when I went back, of course they fixed it or whatnot, and they fixed it in the system. But other than that, they was really, they was on point and they took really good care of me. So I can't say that. My next appointment with them is December the 1st. So mark your calendar because your girl going back to get an update on my breasts and all that good stuff.
About it. And I cannot leave y'all without showing y'all a sneak peek of what's going on with myself, being that y'all on this journey with me. And of course my boobs are going to be sitting up really high. I chose high profiles, but of course they have to drop. If you're looking to get your boobs done, then you should already know that your boobs have to drop into position. But I think everything looks really well, especially, of course, I had lipo to my stomach done. So it's like once my boobs got lifted up off of my stomach, then it's like you can see the true definition of the shape of my stomach. So, your girl's looking real zaddy-ish. So what y'all think? Like, I think I look amazing. Like, I can't wait to heal. So yeah, this is just an update. Those of you that do not follow me on my other social media sites, then you wouldn't know this, but I had a BBL done last July by Dr. Memiscus at Havana Plastic Surgery. So he is who did my lipo. And of course, I had a tummy tuck done in 2016. So yeah, we'll talk more about those things later on other journeys. And of course, here's a picture without a bra on. I just believe I got my ass right back in that bra real quick after this pic because, yeah, that bra was really important. But I just really wanted to see, like, how my boobs look in a dress. Like, come on now. Like, that's curiosity. So I had to see. So, yeah. So in 1 month, I will give you all an update. Stay tuned, gang. Make sure y'all like, comment, and subscribe, and stay blessed.
Listen.